Ignoring the warning signs of diabetes can lead to severe consequences. Be alert for symptoms like sweating, shakiness, dizziness, confusion, extreme fatigue, blurred vision, and unusual thirst or hunger. Early recognition of these symptoms can be life-saving. This is the story of Maria and her son Eric, illustrating how timely actions were crucial. Scene 1. Maria at home. 0:45 to 1:15. Maria, a devoted mother living with diabetes, was in her kitchen preparing lunch. She felt a bit tired, but dismissed it initially. Suddenly, dizziness hit her. Her hands shook, and she became drenched in sweat. Her heart raced, making it hard for her to stand. Confusion overwhelmed her, and she struggled to articulate her thoughts. Scene 2. Eric notices something wrong. 1:15 to 1:45. Eric, her 12-year-old son, noticed his mother leaning heavily against the counter. He saw her pale complexion, sweaty forehead, and trembling hands. Recalling the nurse's advice from their clinic visit, if your mother appears weak, dizzy, sweaty, or disoriented, act swiftly. Fear surged within him, yet he knew he had to remain composed. Scene 3. Taking action. 1:45 to 2:15. Eric dashed to find their neighbor for assistance before grabbing the phone. With shaky hands, he dialed the emergency number. He clearly communicated his mother's symptoms to the operator, detailing the situation. While awaiting help, he remained by her side, holding her hand and softly encouraging her. "Mom, help is on the way. Just hold on." Scene 4. Waiting and caring. 2:15 to 2:45. The waiting minutes felt interminable. Eric frequently checked her breathing, wiping the sweat from her brow, reassuring her. He gently positioned her into a chair to ensure her safety, focusing solely on keeping his mother safe. Scene 5. Help arrives. 2:45 to 3:15. Before long, neighbors and medical professionals arrived. They evaluated Maria's condition, measured her blood sugar levels, and initiated emergency treatments. Eric's swift actions ensured she received necessary care before her situation became dire. Maria was promptly transported to the hospital for additional care. Scene 6. Hospital recovery. 3:15 to 3:45. At the hospital, doctors and nurses continued to monitor and care for her. Intravenous fluids, medications, and careful supervision helped Maria regain her strength. Throughout this time, Eric remained close by, understanding the significance of recognizing warning signs and acting promptly. Scene 7. Back home. 3:45, 4:15. A few days after, Maria returned home, feeling stronger, smiling, and full of gratitude. She embraced Eric tightly, whispering, "You were my little nurse, my hero." Eric felt a sense of pride, but knew he had simply done what anyone would: remain calm and respond quickly. Scene 8. Educational ending. Moral. 4:15 to 5:15. This story emphasizes that anyone, even a child, can make a significant difference during emergencies. It is vital to know the warning signs of diabetes: sweating, shakiness, dizziness, confusion, fatigue, blurred vision, and unusual thirst or hunger. When you recognize these indicators, stay composed, ensure the person's safety, contact medical help without delay. Prompt action can save lives. Eric's courage has not only aided in his mother's recovery, but may also inspire you to act if a loved one is at risk.